What if a tiny cut on your hand could trigger one of the most painful diseases known to medicine? No fever at first, no warning signs. Then, days later, your jaw refuses to open. Your neck becomes stiff. Even taking a single breath turns into a struggle. It sounds like something from centuries ago, but this disease still exists today. And every year it claims thousands of lives around the world. This is the story of tetanus, a deadly infection that doesn't spread from person to person, yet can completely take control of the human body. What is tetanus? Tetanus is caused by a bacterium called clostridium tetani. Unlike viruses that spread through coughing or sneezing, this bacterium usually enters the body through a cut, a puncture wound, burn, or deep scrape. Many people believe rusty nails cause tetanus, but the real danger isn't the rust itself. The bacteria naturally live in soil, dust, and animal waste. Rusty objects are simply more likely to be found in places where these bacteria are present, and they can create deep wounds that make it easier for the bacteria to enter the body. That's why stepping on an old nail in a garden or getting injured while working outdoors can become a serious medical emergency. The hidden attack begins. Once inside the body, the bacteria don't immediately make you feel sick. Instead, they settle into damaged tissue where oxygen levels are low. There, they begin producing one of the most powerful nerve toxins known to science. This toxin quietly travels through the nervous system. By the time symptoms appear, the bacteria may already have released enough toxin to affect muscles throughout the body. The scary part, most people have no idea anything dangerous is happening during this stage. A small wound may even seem like it's healing normally, but underneath the surface, the nervous system is slowly coming under attack. Section 3. The first warning signs. Symptoms usually begin several days after the injury, although the timing can vary. At first, the signs are easy to ignore. You might notice stiffness around your jaw, difficulty swallowing, or tightness in your neck. Many people mistake these symptoms for a simple muscle strain, but they continue getting worse. Soon, muscles begin tightening without warning. Simple movements become painful. Even smiling or speaking can become difficult, and this is only the beginning. As the toxin spreads through the nervous system, the symptoms become impossible to ignore. The muscles of the jaw tighten even more, creating the condition commonly known as lockjaw. Opening your mouth becomes painful. Eating and drinking become difficult. Then the stiffness spreads into the neck, shoulders, and back. Muscles that normally work together in perfect balance begin contracting at the same time. Instead of helping you move, they fight against each other. Even a small sound, a bright light, or a gentle touch can trigger powerful, painful muscle spasms. These spasms can last for several seconds or even minutes. In severe cases, they're strong enough to bend the body into an extreme arch. But the greatest danger isn't the pain. It's what happens when the muscles responsible for breathing become involved. If the chest and diaphragm can't move properly, the body begins running out of oxygen. Without immediate medical care, tetanus can quickly become life-threatening. Fortunately, modern medicine has dramatically improved the chances of survival. Doctors begin by thoroughly cleaning the wound to remove infected tissue. They give antibiotics to stop the bacteria from producing more toxin. Patients also receive tetanus immune globulin, a treatment that neutralizes toxin still circulating outside the nervous system. If muscle spasms become severe, doctors may use medications to relax the muscles. Some patients need intensive care and a ventilator until they can breathe safely on their own. Recovery doesn't happen overnight. Because the toxin affects the nervous system, healing can take weeks or even months. The body must slowly rebuild normal communication between nerves and muscles. The good news: tetanus is one of the most preventable serious infections in the world. Routine vaccination trains your immune system to recognize the toxin before it can cause harm. That's why health experts recommend receiving tetanus vaccines during childhood, followed by booster shots throughout adulthood. If you suffer a deep or dirty wound and you're not up to date on your vaccination, seeking medical care as soon as possible can make a critical difference. A tiny cut may not seem important, But sometimes, the smallest injuries can hide the biggest dangers. The best protection isn't luck, it's prevention. If you enjoyed this video and want to explore more fascinating science, medicine, and hidden facts that shape our world, make sure to subscribe to Think Frontier. Thanks for watching, and we'll see you in the next video.